to Doctors Christian Brenes and Wally Renne.
Well, thank you everybody for joining. We're going to be sharing some information about this topic that nobody's talking about right now, right? COVID-19 is our new hot topic. I thought digital dentistry was the hot topic, but this one is really hot topic just because it's impacting everyone worldwide. And I think it's really important that right now that everybody's doing webinars, we have a webinar that we can share with people that can spread some knowledge as far as what we can do as dental professionals to help not only ourselves with digital technologies, but also help others in this really sad situation we're going through. Everybody knows, I guess, Wally Renne. He actually, I'm part of the team right now. And I have been working for a couple of months at NIOS, the Medical University of South Carolina. He is the Dean of Digital Dentistry, something unheard, quite honestly. I mean, they have been doing really great things at the university. And that is basically the reason why I joined the team. I think they're doing great things for the profession. Innovation there is outstanding. It's a state-of-the-art facility. And Wally is actually one of the leaders. So I'm very glad that he is here joining us as well, because as a team, we have done a couple of things now to help with this pandemic, including masks. We're going to be talking about a couple of these. This one is one of the first prototypes. I'll try to get closer to the camera here. One of the first prototypes using this filter, which is the P100 from 3M, and there's another one from Honeywell, different brands. And we have another one here, which is a prototype that we did at MUSC that includes a little box in which you can use HEPA filters, but don't worry, we're going to be covering all these topics, and Wally's going to be explaining some of the differences in between the masks. On my end, I need to start. Well, Wally, do you want to add something before I get started?
No, you're good, man. I'm just happy to be here.
Awesome. So just a quick disclaimer, we are not virologists, we're not pulmonologists, and all the data that we have is basically gathered from some more professionals that have been willing to share that information with us, and from articles. Most of these articles actually talk about not even the COVID-19, because that's pretty new and we don't have a lot of data about it. But it talks about previous research done with SARS virus. SARS is basically an acronym for severe acute respiratory syndrome. And then MERS, which is causes the Middle East respiratory syndrome. So it's important to know how this actually got started before we start talking about different topics here. So it just happened that the World Health Organization got reports from an epidemic that it was unexplained. It was a respiratory disease. And this was in Wuhan, China. When the World Health Organization got this report, the etiology was attributed to some sort of coronavirus that it started there. We know it's part of the coronavirus family, and they named this virus COVID-19 as an acronym for coronavirus disease 19. So at this point, we don't have a lot of information. This is pretty new, and we're trying to fight this virus as a pandemic right now. I'm going to share my screen real quick here. So let me know if you guys can see my presentation.
Yeah, looks great.
Yep, looks good,
Looks
Christian.
Good.
Yep.
Okay. Is that full screen, or you guys
No,
can see my?
it's like the presenter view.
Okay. Good deal. Can you guys still see me, or
Yeah, this
just
is
a
great.
screen?
This is great.
Okay. So basically, in the as I was explaining, let me get rid of this poll. Anyway, I was explaining about this virus. In just a matter of weeks, maybe even days, we got many different recommendations, and the recommendations have changed quite a bit when it comes to safety and different things we can do to fight the virus. The reality is that we have noticed trends from different countries. And one of the major trends that we have seen, especially in countries that have been using masks, is that there is a trend to reduce how people or how many people are getting infected just by letting the overall population use masks. This is one of the main things that can be used right now to fight the virus. There is obviously a shortage in alcohol and different things that we know we can use to fight the virus. But there isn't a specific trend with this kind of devices, in particular masks, to help us reduce how quickly and how effective the epidemic, in this case a pandemic, can be reduced in a certain population. Now, at the beginning, this is what was happening actually. You know, at the beginning it was motivated that, or it was actually cheered by different organizations that people in general should not be using masks, mostly because there was a fear of saving masks for healthcare professionals. And if everybody was going to start buying masks, then all of a sudden, all the people in the hospitals, healthcare professionals, would have a shortage. But it doesn't really matter what happened. We still have a shortage of masks. And these recommendations have changed quite a bit as well. So we noticed this, you know, being in an academic institution, we really become aware of national and state issues before, I will say, the general population. The most, I will say, possibly the most dangerous thing about this virus is not only the possibility that it can infect people really quickly, and people that are in risk can die, as we have seen in Italy, Spain, and many other countries. But one of the major problems is actually the fact that there is an exponential infection rate. In no country, as of right now, is actually prepared nowadays for such a demand of medical supplies. So what is going to happen? Okay, the virus can spread really fast, and then after it spreads, everybody's going to go to the hospital, and we don't have enough equipment, enough resources to try to treat all these patients that can potentially be coming to healthcare facilities. So we were aware of the situation, and we started developing what we will call a Plan B weeks ago at MUSC. Try to come up with different ideas of, okay, what is the worst case scenario? And if we are going to be prepared for that worst case scenario, what things can we do as, in this case, dentists, to help fight this crisis? So obviously, having on hand different 3D printers and different digital technology tools that we have, we actually, in this case, Wally came up with a team of professionals, and we try to design a couple of things. And I will say probably some of those things were mask prototypes. Wally, can you explain their roles at the university?
Yeah, so we constructed a team of pulmonologists. We have some epidemiologists, we have microbiologists, we have engineers, we have just phenomenal people in general that all kind of collaborate on this and tried to make something that was going to be easily printable and would have the ability to be assembled and used all around. And so that's kind of where we're heading with this.
Okay. Yeah, I mean, as a matter of fact, all these mask prototypes that Wally's going to be showing, we personally test those at the hospital, looking for leakage and looking for possible filtration. So these have been approved at least by our healthcare facility in case there is a shortage, that we can start producing these kind of masks as well. So this is, in the people that can see the presentation there, this is basically the new rationale behind what we're going to be talking about. The new rationale is not only the fact that the government is promoting this, even though things have changed in the last couple of days, but implementing this in a way that everybody is aware is really important. Everybody should be aware of this. What you see here are basically the projections based on the number, in this case, million of cases, and the bell curves that are associated with basically doing nothing, which is that red line that you see right there. If people in general don't do nothing, these are the projections that people will actually see, which is going to be over, at least this is in the United States, is going to be over 50 million people, 57 million cases to be precise, is what we will expect if we don't do nothing. I think personally, you know, I will have to be honest. At the beginning, I never thought it was going to be that bad. I thought it was going to be more like a flu or something. But then I started noticing the trend, and it became a little scary. So that's the red line right there. So it's basically the trend if we don't do nothing. And then that green line that you see right there is the representation of projections based on the fact that we can use a combination of social distancing and masks. If you say there is a reduction based on these projections, there is a reduction of around 50%, 50% of the risk, which is quite good. If we talk about a virus that is exponentially growing. The other thing is, if you see the difference, is not only estimating how many cases we can basically reduce as far as the risk factor, but the other thing is in what period of time those cases are gonna get infected, how many patients are gonna be infected in a period of time. And as I was saying, if we can reduce that in 50%, but also we can provide a larger period of time, there is a less risk for healthcare facilities to actually collapse. So we're basically spreading the amount of cases that are infecting over a longer period of time. And that way we can go with the supply and demand rationale to be able to see most of these patients. So it's really important to recognize that we have to have hygiene. We have to follow hygiene instructions. We need to use social distancing, and masks are basically one of the things that we should apply, not only as healthcare professionals, but the population in general. Okay, so let me talk about this, because this is also really important. This image is actually very popular now in social media groups. It's a new image that I've seen in a lot of different Facebook groups and social media groups. And it basically represents how the airborne diseases can potentially spread over distance. They can spread as cough or sneezing ballistics. So an infected person, just by breathing, can spread around, can spread all these particles in a radius of 1.5 meters, which is around 5 feet-ish, 5 feet-ish, just by breathing. That is unbelievable. So that's why social distancing is really important. Now, if they cough or if they sneeze, and and they don't have anything to cover, they can spread that pretty far away. I mean, we're talking 1.5 meters or more than 2 meters, which is around more than 7 to actually 20 feet distance. That radius is pretty scary. So, you know, if you're in a room and somebody's sneezing, that's why at this point everybody's freaking out. Somebody's coughing, somebody's sneezing, and then you have 7 or even more than 20 feet of distance that the virus can travel and can infect more and more people. Not only that, but the virus can stay in different surfaces. So somebody will cough, and if the person is infected, the droplets can stay in different surfaces for a long period of time, and somebody can come later, they can touch the surface, get infected, and then get the virus into their system. So it's really important to recognize that also the COVID-19 is pretty small. We're talking microns here. And this representation that you see on the screen are for droplets that are below 10 microns. The reality is the virus itself is, if I'm not mistaken, is around 120 microns. But now, obviously, those viruses are not alone. They're usually covered by droplets, some sort of saliva or liquid. So when we talk about how we can potentially reduce the risk, we need to talk about particles that are less than 300 microns. So this is basically the standard of care. As of right now, in healthcare facilities, is using N95 masks. These N95 masks, the special thing about it is that when you're dealing with such small particles that are highly contagious, you need to use something like this in order to protect yourself. They offer much or better protection in particles that are less than 10 microns. Now, this is the thing. The Center for Disease Control and Prevention, at the beginning, when we're talking about this disease, the official recommendation by the CDC and FDA was that non-healthcare professionals shouldn't be using these masks, or I'm sorry, shouldn't be using masks that are not N95 just because they were not effective. And the reality is that is true in certain way. We will review the different kind of filters, and we will review the different kind of masks that we have. But the reality is, if you're using regular masks that are not N95, basically, those masks are usually used to filter particles that are larger than 10 microns. In this case, when we talk about coronavirus, COVID-19, SARS, this kind of particles that are less than 10 microns, the efficiency of blocking those particles can only be achieved with a mask like this or higher filtering. So the National Institute for Occupational Safety and Health, which is usually called NIOS, they have different classifications for masks. When it comes to masks, they have an N classification, which is, they have N, R, and P. N stands for non-oil resistant. For the most part, in healthcare facilities, we use N masks because we're not dealing with oil. But the most important thing is not the classification about if it is oil resistant or not. In our case, the most important thing is that we need to know the number, because when it comes to the number, for example, 95, it basically stands to masks that can filter 90% of particulate matter. Those are usually good for short-term use but long-term use is not quite that good. N99 usually stands for filtering 99% of particulate matter, and is generally adequate for safety. But the reality, and it just depends on what is your job. I mean, what is your job as a healthcare professional? If you use that mask for a long period of time, that 1% that slips through can still dangerous over a really long period of time. So we still don't know how many uses you can get out of a single mask, but that's something that we have to be aware too. You can reuse it, but we don't know for how long, especially if you're sterilizing these masks. And we're going to be talking a little bit about that topic too. Then there is another classification, which is N100. N100 is basically the best filtering you can get. It usually filters around 99.9% of particulate matter. And still, those tiny trace amounts can slip through. I mean, there is no mask that is perfect, if you will. But even there is that little trace amount, that trace is not it's not enough to be harmful without a sustained exposure for a long period of time. So if you see the P100 filter, is basically an N100 filtering, if you will. The only difference in between the N and the P is the fact that P is what means that it will be resistant to oil. So the P100 is a filter that most people in the painting industry will use sometimes, or even to treat surfaces with asbestos that can cause cancer. This is what these people will use, which is a pretty good high filtering, and it can be used for a long period of time. Obviously, we have to take care of the filter, try not to touch it with your hands, try not to, manipulate it in ways that you can possibly open the surface or can make those pores that the filter has way bigger than what they are. So people just have to be careful with that. But the fact is, a new filter is 99.9% filtering the particulate matter. Now, this is what we see in social media. Again, all these posts and all these people, they're trying to help, and we really appreciate the willingness of people trying to do something. But the fact is, all these masks that you see on the screen are not effective against the virus, okay? Now, according to the CDC, when they come up with these recommendations, even though the CDC says they don't offer much protection against something like COVID-19, so healthcare professionals, in my opinion, shouldn't be using this to treat patients. The fact of the matter is that partial filtering is still better than no filtering, still better than nothing. So why this is important? Because even though imperfect protection doesn't mean completely useless, in a way that, if you use this mask, you can still have a lot of risk. If you're treating patients that can be infected with the virus, you can become infected. In a way, yes, but the other thing is, why using a mask, even though it doesn't have a high filter, can be useful for the whole population? The reason is this. The reason behind that is this. I wish everybody will have a high filtering mask, but even if you don't have one, the fact that you can use a mask will possibly help quite a bit. This is because, it can also lower the number of aerosol droplets from cough and sneezing expulsions. So it's not only the fact that you can protect yourself from inward protection, if you will, but the outward protection helps a lot. The outward protection basically raised the question. So if all the particles, if all we want is to mitigate the pandemic, how much does a four-fold reduction of particles will reduce the transmission from person to person? That's the whole question here. So the intuition will suggest that even an imperfect mask will possibly offer a similar protection to something like social distance, washing your hands, or not touching your face. And that's why it's really important. So if somebody believes that he can be infected with the virus, and he can be, you know, he can have the virus for whatever reason, especially healthcare professionals. If you're treating patients, urgent care, and you're treating patients, and you might think, well, you know, I don't feel bad, I don't have any symptoms, but I would just go shopping and I would just like, I need to continue my life, even though you don't feel like you need to wear a mask. Is good for the whole population to be aware and help in a way that even if you don't use a high filtering mask, you can go ahead, get any regular mask and have your social life out there and try to reduce the risk for everybody getting infected. Okay, so now there were a lot of questions. We came up with these mask prototypes a couple of weeks ago. And I got a lot of questions, especially in social media regarding, because we don't really know what a HEPA filter was. Quite honestly, I didn't know what a HEPA filter was a month ago. But we did the research, and there's different types of filters. We have EPA, HEPA filters. Then we have HEPA, HEPA filters, and we have ULPA filters. By definition, EPA stands for efficiency particulate air. HEPA stands for high efficiency particulate air. And then the ULPA is basically for ultra low filters. Now, when it comes to the numeric value of it, we have, for whatever reason, we have 10, 11, 12, and then we have HEPA 13 and 14, and then we have the ULPA. When you see the retention percentage of those filters, the higher you go, the more filtering you get. So basically with EPA 10, it will get like around 85% filtering. 11, you will get 95. And then 12, you will get around 99.5%. The recommendation that we're following based on healthcare professionals and based on things that the industry has developed for things like air purifiers and vacuum filters, and try to reduce the risk for potential infections, is to use HEPA filters. So with a HEPA filter, HEPA 13, you will get 99.95% filtering, and HEPA 14, you will get 99.99% filtering. So if we talk about viruses like, for example, SARS or coronavirus, COVID-19, knowing this virus is so tiny, and we need to use high filtering as healthcare professionals. Now, you know, even though ULPA filters are tentative, because, you know, the temptation is to use whatever will protect us the most, you know, it just becomes unneeded in a way that it can be overprotection. And the fact that you have so much filtering is very hard for people to use that kind of filtering and breathe normally. Sometimes even with valves, that's something that will happen. So at this point, even though it's a temptation to use something like ULPA, the fact that you cannot breathe really well in the fact that you have to inhale and exhale, yeah, it can create some sort of pressure inside the mask. And not only the fact that the fact that you will exhale the air, it can cause leakage around the seal of the mask. The other concern is the possibility of accumulating a lot of carbon monoxide inside the mask, and you don't get enough oxygen. So that's the main concern. We have to, at this point, we have to stick to HEPA filters, and this is what we're gonna be talking about with the mask prototypes. And I will let Wally go from here.
Thank you, Christian. Hey, everybody. I hope you're enjoying the evening. I am just going to go a little bit through some designs that we've developed. And before I start, I have to preface this by saying that there's literally over 2,000 mask designs. Many of them aren't tested. Some of them are flat out terrible. And then some of them are pretty decent. There's a plethora of options, and I don't have time to talk about all different eccentricities of the designs that are out there, but I can speak to some that I've tested and tried. And so we're going to give you a good, solid 4 designs that are phenomenal. You have to understand that as dental professionals, we're categorized as the very high risk category because we create aerosols and we're in close proximity to our patients for extended periods of time. And so, in fact, if you look, there's probably not quite a profession that's higher than us. It's crazy. Who knew that dentists would be categorized as such a high risk for a virus pandemic? But we are. And so the team and I really try to work hard to create something fast, and then pretty much evolve that design over and over again using the help of the community. So this is the first mask that we came up with. It is essentially designed to be split file printed. So one part could be flexible. That part that's purple there that fits against your face could be printed out of TPU if you have an FDM printer, which is a thermoplastic polyurethane, or it could be printed out of like indirect bonding tray material from Sprintray, which would be really cool. And the other part's designed to be printed out of hard plastic, such as surgical guide material or denture-based material, or pretty much anything that you want. And we'll talk about that in a minute. One thing that's important to note is that it does have an exhalation valve, which is important to prevent lack of buildup of pressure in the mask, which creates seal issues. But it's also a weak link in that you need to design it correctly so that it does indeed seal during inhalation, which is why we tested it. And to make sure that if it is assembled correctly, it does indeed work. Now, if you look at the components of the safe box, as they're calling it, it's a very simple design. It has basically an intake grate and a cap, and then it also has the exhalation valve cap. Okay, so it's a really, really easy thing. We wanted to make it to where like high school kids and anybody could put it together, and that's exactly what's going on. People from all around the country are making these and putting them together. Basically, Christian talked about some phenomenal HEPA filtration components. If you cut a HEPA filter and you insert it in, you hot glue it in, you're able to create that seal that we've tested, and then a rubber glove for the exhaust valve. Now, some people say, well, if you cut a HEPA filter, aren't you creating dangerous glass particles that you're going to inhale? I don't know, probably not. I mean, last I checked was MERV 16 had nanoparticle glass fibers, but most other HEPA filters don't have nanoparticle glass fibers. So use it at your own risk. You can definitely go into detail here about the pros and cons and dangers of this. And so this is the design, and it's a pretty simple design, and it's really easy to make. Like Christian said, HEPA filters are about equal to a P100, protecting from about 99.8% of 0.3 millimeters and smaller. And so this is kind of what it looks like. We did test it printed out of the cheapest printed materials on the planet, just because we want to go to the lowest common denominator, fused deposition modeling with PLA, polylactic acid, resins. And so what you need to understand is a little bit of difference of the resin. So PLA, if you are printing out of PLA, which a lot of people are, it's intrinsically biocompatible, but it's also prone to degradation from chemical disinfectant solutions. So with that regard, PETG, which is polyethylene terephthalate, is a much better material for chemical sterilization of the mask. Even holds up better to hydrogen peroxide vapor sterilization and other things. ABS is probably not a good call for this mask, and thermoplastic polyurethane is phenomenal material, very stretchy, very durable. It would be a good material. We've made some TPU masks as well and have tested them. And of course, with TPU, you could do a split mask design. So one part could be flexible to seal against your face, and the next part could be rigid. If you're using SLA, DLP, or LCD printers, you could also split this design and print it separately. And here's just showing the advantages of a flex mask. Is that this is one that early prototype that we printed out of TPU on an FDM printer. Now, if you are just printing solid rigid masks, you have to still seal around your face. It's nearly impossible for a rigid mask to form a seal. So I would recommend, if you do print out of, say, surgical guide material, which is phenomenal because you could autoclave it, at least then go ahead and put this tape on the mask, which is window seal tape. It's a neoprene-based material that we've tested to provide performs a good seal around your face, and then you just peel it off, autoclave it, and then stick on another one. It's just what you have to do. So now regarding the box design, it's pretty easy to put together. There's a lot that you kind of have to do though. So here, if you like arts and crafts, I don't know, can you guys hear my voice over that? Christian?
We don't hear your voice now.
There's a lot that you have to do. You have to kind of cut it and put it all together, and you have to basically do a whole bunch of stuff. And a lot of people said to me, I don't really want to do all that stuff. They said, I don't want to necessarily have to cut things and put things together. And that's fine. We did create a mask where you don't have to cut anything, but this is just one design that we did create because these filters are readily available all around the world. And P100 filters are not. There's filters being sold out everywhere, but these are still readily available and relatively inexpensive. You could get a lot of filters out of one HEPA filter from the hardware store. So you could make 20 of these for roughly the cost of about $2 each. And so you cut this thing and you basically hot glue it in. Now this is the technique sensitive part, and this is the part that worries some people, because what if you miss an area and you're not sealed? Well, nobody's guaranteeing this is going to be 100% perfect, but people are using literally wet bandanas and old t-shirts and because they have nothing else, and this is definitely better than that. But it's only as good as the construction process. So you have to create a seal with the glue. We tested multiple designs to make sure that they were indeed sealed, but I do worry if people are putting these together haphazardly, they might not be sealed correctly. So please take that into consideration. When you get these STL files and you watch the YouTube videos of us designing it, just take some care when you do construct this thing. And the most critical part of this whole entire, what we call safe box design, is not only the seal, but it's also that it's really important that we construct the exhalation valve correctly. So let me just throw this cap on really quick. Hot glue is your friend here. Copious amounts of hot glue. You cannot have too much hot glue in this instance. And yeah, so you could trim it up for aesthetics, but to be honest with you, it's a waste of time because it's only for aesthetics. So now the exhalation valve, Christian mentioned, when you have a good seal in a mask, pressure builds up and air takes the path of least resistance, which is typically on a mask that doesn't have a valve. It's typically out the cheek side. But what happens is when it vents out of the cheek side, COVID could come in. And so what this is using any rubber glove, and there's a template that you could cut, and you basically use cyanoacrylate glue to super glue this thing onto that flat part there so that you could get a seal. When you breathe in, the suction power is so powerful that it compresses that rubber valve against the plastic, preventing leakage. And then you could put the valve cap on so that it doesn't get messed up at all. Now, that's all cool and all, but a lot of people are like, I don't want to mess with all that. So we came up with the Roomba filtration device that we made a box that fits a Roomba 700 filter, Roomba 700 HEPA filter. These filters are really inexpensive. They're readily available, and they will snap right into the mask design. And so a lot of people were building these, and then they commented, you know, why is the box so big? We don't like that the box is so big, because you could have CO2 kind of linger in that box with that empty space. Really wouldn't happen because of the exhalation valve, but if it was a sealed system, that's true. And I thought, you know, that will get in the way of your loops, and if you're trying to visualize a patient, so we need to eliminate that excess space right there. And so we did. We designed a smaller system, and I don't know if you could see here, but we got rid of the bulk of the volume. And there's been a bunch of people making these and helping me with these designs. Rob Harding is kind of the genius behind this design as well. He said, well, why do we have to have a separate system? Why not have it as all one piece? And I was like, that's a genius idea. Why do we need a separate system? So he combined the room of filter idea to 3 size masks, which are available on Thingiverse now. And these have been working phenomenally well. And they print really, really nice on the Sprintray Pro. And I'll show you some examples in a minute. But then, so, you know, I think this is probably one of my favorite designs. Printability wise though, it needs a good bit of supports. And we're working on creating a support-free version right now. And I'll probably upload that tonight. So here, that's how the Roomba filter fits into that mask. This was printed out of a flexible material. Indirect bonding tray material from Sprintray works remarkably well for this. And it's just really good. We printed a bunch out of denture-based material because they're so biocompatible. They're designed to be pressed against the mucosa for you know, indefinitely if you're using Denka-based materials, long-term FDA approved. So we figured long-term against the face, it would be good. But the problem with these designs is they all required a ton of supports. I'm talking like massive amounts of supports. So we modified the design. I should say Tobias Obermeet modified the design, and this guy's a genius at modifying designs for printability. And what he did was he came up with a design that could be printed flat on the print bed with absolutely no supports. The thing prints in 3 hours at 100 microns using Sprintray not surgical guide, but splint material. And that's what I've been making most of mine out of. In fact, I have one right here that I'll show you guys in a minute. But this thing is just, it prints flat like that. Really cool, and it is modular, so it does take either the safe box system or the HEPA filter system, which you would print separately. This is the latest one that I printed this morning on the Sprintray Pro. That's at 100 micron resolution there with the splint material, which I think is probably my favorite material to use right now. I just like the way they're coming out. So then then Christian's like, well, you know, what if people don't want to have a Roomba filter? They could get P100 filters. So Christian pretty much designed this where you could just snap in your P100 filter to this mask design, which is readily available. And Christian's been printing this out of flexible material on the Sprintray Pro, and they've been just amazing. But we found that the P100s now are getting in low supply. So then we created this other mask that lets you design basically your own P100 by cutting a circle of a HEPA filter and then bonding that in with super glue or hot glue, and that's available online too. So all these different designs. Baron Grutter has this really cool design. He kind of took the HEPA filter design and then made it to where it snaps into the bottom of the HEPA filter, bottom of a mask, and it's available for free on his website. It's probably one of my favorite designs out there. It's a really good design. So I'm going to talk just a little bit though about FDM printing for a second, because a lot of these masks are being FDM printed, and I'm concerned about porosity and layer and infill, and we just need to have a quick discussion about this because it's pretty serious. If you think that your mask is protecting you and it's not, you have a false sense of security. There's a lot of good research out there on how to modify your slicer settings for fused deposition modeling in such a way that you have gas-proof masks. So essentially, not only watertight, but also airtight. systems. And basically, if you look at the scanning electron micrographs of microporosities, what it really comes down to is flow rate, infill rate. So the amount of infill, and it also comes down to extrusion rate. So pretty much, if you do a 1.5 or a 1.2 extrusion multiplier and you do 100% infill, you're going to have airtight prints, okay? It's really simple to change these in your printer settings. So 100% infill, which means basically it's going to be, they're not hollow at all, and do an extrusion multiplier, 1.2 or 1.5. Anything above 100 is going to be phenomenal. Now here's the problem. You print all these masks and you call your hospital and they're like, we don't want them. Our university is taking printed masks, but some are not so open-minded. They're just concerned about what if you put it together wrong, what if you printed it wrong. So what most hospitals around the world will accept are face shields. There's a lot of proven designs. I've been using the ones from Prusa. They have 4 different designs now. They could be stack printed, so you could print literally 10 at a time on say, a Prusa Mark III. And I've been using this basically polypropylene transparent film from Amazon, which is basically just for like notebook dividers, but it's really stiff. It has the perfect consistency and it's relatively inexpensive. So 100 sheets for $20. And I've made a ton of these using various different designs, and you could sterilize these things or just chuck them. They're not that expensive to print, and they're not that expensive to make. So each one is roughly about $1 or less. So you're all set. This is another really good design on Thingiverse. The reason why I like it is because it's solid. A lot of hospitals won't take things if they're open at the top because aerosols could get down in. They're not really designed to prevent aerosols from entering, so I don't know why that's a concern, but these are sealed at the top. Lastly, I'm going to talk just a smidge about ventilators, and then we're going to open it up to questions, because I think that's really important we can answer your questions. Ventilators are a little bit tricky. You have to be careful trying to print ventilators and ventilator dividers and things like that, because there's a couple of concerns with dividers, in that the hospitals won't be able to monitor the tidal rate correctly, and it could cause issues. These people that are suffering from COVID-19 need to be ventilated for weeks, not days, not hours, but weeks. It's a terrible thing. And that's why it's such a crisis, because normally if you say you got pneumonia, you'll be on a ventilator for a day or two, you're good to go. These people have to stay on a ventilator, and that's causing so many problems. And so people, this is my favorite design that I found. It's from an Italian group. You hook this up to a CPAP machine, and it's a 3D printed. It's called I think it's called the Charlotte valve. That valve up top there goes on a mask that you could buy on Amazon right now for $90, and then you hook it up to a CPAP type machine, and you're good to go. So before we break and answer and open it up, you just have to talk a little bit about disinfection of these things, because they're, as you know, prints are not perfectly smooth. There's creases and nooks and crannies. There's been really good success with UV sterilization. In fact, 405 nanometers is what the cure boxes tend to be at. And so you could throw these things in a cure box, and not only are you curing it, but you're also disinfecting it at the same time. It's not going to be fully sterile. So, I mean, unless you're doing surgery, you don't need a sterile mask. You just need a disinfected mask. And so if you look at the time, so at 5 minutes, you're going to get a pretty profound log reduction in bacterial load. This is actually COVID, MERS COVID strain, which is a little bit different than COVID-19, but UVC is really good at killing things. And so anywhere between 5 and 20 minutes is kind of what some people recommend. And there's some studies, such as the bottom right, that show actually 60 minutes is better. It's just depends on how far away you are from the light. In the bottom right side, that was 6 feet away. So it's we're way up close. So you could look at the bottom left scale. And of course you could use ethanol, isopropanol, and you could soak the whole mask in this solution. We're using hydrogen peroxide gas or vapor sterilization. Most hospitals have these systems where you could put the unit in there and it's non-destructive. it's cold gas, so it's not going to heat or warp anything. And of course, if you're desperate, you could stick PLA at least in an oven at 70 degrees Celsius for 30 minutes and disinfect it. But that's really all I have
Yeah. I would like
on
to
this.
add,
And so
Wally,
we're going to
that
kind of open it up to questions for you guys now.
I'd like to add, Wally, that
See if we
can
can
you hear me?
answer any of these.
There
Can
are
you
a
hear
list
me?
of questions. Sorry, guys, just so that you guys both know, there's a list of questions here down on the Q&A.
Can you hear me?
Questions and answers.
Can you hear me now?
Somebody said, can you show the previous slide? I don't know what slide that was. TPU absorbs a lot of IPA when sterilized and loses a lot of its characteristics. Would not have a problem. You wouldn't necessarily sterilize those with IPA. You could use other means like hydrogen peroxide gas sterilization.
Can you hear me now?
It's hard to sterilize, and that's one of its big disadvantages. It's a good point.
Okay, I had some issues with the mic, but I just wanted to add really quick there.
Can this fit in my Moonray printer? Kristen, you know the answer to that?
Yeah, give me just a, can you hear me there, Wally?
I don't know if Wally can hear you, but we can hear you.
Yeah. Okay, well, I wanted to add just on that final part, based on Wally's comments, that at this point we're focusing on how we can reuse different things like masks. And one of the main things or main considerations is that if you're using a mask, you can always go ahead and sterilize the mask, but you also need to sterilize the filter. What if the virus stays in the filter and you're just reusing the filters and people are touching the filters? So some materials like, surgical guide, resins, for example, those can be autoclave. Most people don't have gas. For hospitals, it's way easier because, they can just stick a couple of masks and filters in there and they can sterilize with gas. But for private practitioners, obviously the first recommendation is don't see patients unless you have to at this point. But the other thing is if you have to reuse and you have to sterilize, the only thing that we know that will work is temperature and UV. But now the temperature, as Wally was saying, has to be above 65 degrees Celsius for around 30 minutes. And we know that for sure. And the other thing is UV, there are different wavelengths. And now we're studying a way to sort of come up with an affordable way of doing this. But for example, units like the Procure, the UV that has to be used is very specific and is UVC, which is a wavelength of 245 nanometers to 254-ish. And this is UVA. So if you stick a mask in there or a filter, it's not going to do anything to the virus. So we really have to come up with some upgrades to be able to use UV in order to sterilize this. But we need to come up with a way to cold sterilize the masks and the filters in the future. Some people are asking there, like how many times we can reuse the masks, and that's something that we don't know at this point. We're making this effort to just have a plan B, maybe even plan C, D, E, whatever, just because there is a shortage in medical supplies, as I was saying. So another question regarding if this is a liability, a legal liability. I mean, I don't know where AEC is from or if he's watching the news. But I mean, obviously, if you don't have a mask, what are you going to use? Like, what are you going to do if you have a patient, urgent care, an emergency? Possibly you can refer to a hospital or, maybe another colleague of yours. But this is a solution for not having enough supplies. If you can buy a 3M mask that can be compatible with this filter, go ahead and use it, along with your protection that you should have as a provider. But if you don't have any, then the options become these kind of masks. If you cannot get this, then you can get a Roomba filter. If you cannot get this or a Roomba filter, then you have the option of using a HEPA filter. The thing is to have options, because at this point, we're very early in the stage compared to especially some other countries. But we're going to reach a point in which we don't know if it's going to be in the next couple of weeks. Maybe even it will be a couple of months. But if we don't have enough medical supplies, the liability is going to be much higher if you don't use a mask because you don't have one. So you better use something to protect yourself and to protect your patients too.
So all the mask files are available on Thingiverse if you look us up, also on my YouTube account. And the other thing that you have to consider is that we're not saying, use this in place of a N95.
Right.
We're saying use this if you have nothing. Use this if you're using a wet bandana or a T-shirt or a hand sewn mask or something worse, which we're not trying to say that this is the normal, this is the best. In fact, quite the contrary. We're trying to say people are coming together to make things for people who have nothing, and that's kind of what this movement's all about.
That's right. Another thing is these masks, I haven't been able to figure it out. I mean, there is no way. I tried different ways to print it with the Model S. It doesn't really fit. It's way too big for the build platform. So as of right now, we're using FDM or the Sprintray Pro to print those. The Sprintray Pro is big enough to accommodate a mask and the box, but it's not possible with the Model S.
With the Model S, you can print these.
Yeah.
And, these are in high demand. This is the filter kit where the Roomba filter kind of snaps in. You'd see that and clicks in. You could print a ton of these and maybe partner with the lab to print the mask part, because these could be also just thrown away at the end of the day as well.
Right.
And they kind of just slide in like this.
Right. And obviously the recommendation is to change those in between patients too. Again, what if the filter gets contaminated or even the box? So you should sterilize it somehow or just make it disposable. I mean, it's quite cheap, honestly, to buy a bunch of them, maybe a big bag of filters. So that's something that can be done. In your experience, somebody's asking, Wally, what type of resin is the best for face shields? What's your preference?
Okay, so you don't actually print the face shield itself. So you're just printing that little part. And PLA, if you have an FDM printer, PLA works fine. If you have a DLP printer like the Sprintray or Moonray, I would think that you would want something that's going to be pretty tough. So I've been using splint material because these are getting, a lot of time these are getting sprayed down and reused over and over and over again. Even the polypropylene or polyvinyl chloride face shield part is getting wiped down at a lot of places because these are in such short supply. So something that's biocompatible and easily cleaned with ethanol or other disinfectants, such as I've been in love with the splint material. Yeah.
Dr. Malley, I think it's our Dr. Malley, but
What?
Maybe there is another one, I don't know. But Stephen Malley says that if we can share the instructions and links of the preferred mask to be printed with the Sprintray Pro. Yeah, of course. I mean, we have been sharing this in social media, and we're going to be sharing the link when we share this webinar via the Sprintray email chain they have, so people can access the files as well. What else? Wally, do you think full PPE will be enough for dentists? Do you think we should modify suction devices or add some additional barriers between the patient and the operator?
Yeah, you know, it's going to change dentistry forever. I don't know what they're going to make us do. It could be that we're going to have to UVC sterilize operatories, filtration in the suctions, but filtration in the HVAC units as well. Because if we do create aerosols, and we know that the virus lasts 3 hours in an aerosol environment at least. And so if your appointment's only 30, 40 minutes and you're creating aerosols and the next patient comes in, everybody in that room is going to be exposed. And so to protect the patient, the next patient, something is going to probably have to be done. OSHA, I was just on the phone this morning, they're, for the person who helped with the HIV and AIDS on onset early on, she helped create the kind of guidelines that dentists should wear gloves, and people freaked out about that. Now she's kind of consulting and helping people, you know, what should dentists wear in light of COVID-19. And so there's going to be some guidelines that are going to be pumped out, but I don't think it's going to be your standard status quo that we've been doing for the last few decades. This is the link of the, I will send it in the comments. It has all the files. It has 3 different mask designs, sizes. It has the box system, it has the Roomba system, it has the integrated mask system. I will copy and paste it in the link somewhere for you guys to copy in the comments section.
You can just send it to me and we can always send it out.
Okay.
Yeah.
Okay. I don't want to interrupt, but we actually do have someone, the actual president of Keystone Industries Dental Group, Ira Rosenau, is on. Ira, I'm going to take you off of mute. The discussion today has mainly been around masks, but there are other items that are needed, such as swabs for testing. Ira's been involved and will share a few comments about that. So, Ira,
Awesome.
You are now permitted to talk.
Are you guys able to hear me?
Yes, yes, we can.
Yes.
Oh, terrific. Well, first of all, I very much want to thank Sprintray for inviting me to this webinar. I also want to thank Wally and Christian for a very comprehensive overview of what's going on out there right now. You know, the odd thing is, you know, 6 weeks ago, the world looked one way, and here we are 6 weeks later, and we're all trying to adjust to a suddenly new reality. And one of the things that's been really gratifying as someone who's been very involved in the 3D printing industry over the last 4 years is to watch how partners in the printer space, the users on the ground, doctors, labs, designers have all jumped in to try and pitch in what is a unprecedented and chaotic environment. So I think this was a really great webinar. I think you guys did a really nice job of hitting on some of the design issues and, frankly, some of the potential problems, like a false sense of security with masks and what might happen if you don't actually get it right. And when you start to think about sterilization and how do you work on these projects responsibly, I think Christian and Wally did a really fantastic job of pulling together a lot of information that's been put out publicly over the last 2 to 3 weeks, and to make it digestible for the audience. So I very much, before I touch on some other items, want to thank Sprintray and Christian Wally for doing a terrific job with this. There are a lot of things happening very quickly in this environment. 3D printing can offer a lot of solutions to shortages are a little bit easier to do, like face shields, to things that are more difficult, like N95 masks. The community has really pitched in, And there's been a really nice free flow of information to help everybody understand what the possibilities are, while at the same time recognizing some limitations, some concerns, because these are medical devices, and you have people on the front lines of the fight against this this pandemic who need to be protected appropriately. But whether it's a face mask, whether it's a shield, whether it's a ventilator splitter that allows 4 ventilators to run off of one source, or whether it's ventilator valve, the 3D community has jumped in to help with supply, with design, with biocompatibility. And it's been encouraging and frankly a little heartwarming to be a part of this industry and see how responsive it has been. Something we've been working on very heavily over the last 2 weeks has been the focus on the nasal swab project. So for those of you who don't know, I'll just give a little bit of a background. There is a massive shortage of COVID-19 nasal swabs for test kits. Generally, the world supply comes from one factory in Italy. They are under the swarm of the pandemic in Italy, and supply in the US, Europe, and other countries has dried up. And so very quickly, some of the health institutions, hospitals, research centers, and industry have jumped in to try and determine how can we help fill the gap with nasal swabs that work, and how does 3D printing play a role? A lot of the work is being coordinated out of Beth Israel in Boston in conjunction with Harvard. They are essentially working with industry to review designs for nasal swabs, to review the materials that are being used for nasal swabs, to review the workflow, the biocompatibility, the physical properties. Will the nasal swab be sufficiently flexible? Will a brittle material run the risk of breaking off in the nasal passage, which is a big disaster? How do we assure that this material can be properly sterilized? How do we get it into the marketplace? These are very, very complicated issues, all of which are being done on an accelerated way. FDA has come out and said that generally they will consider this to be a Class 1 device. It is more of a sample collection device than a testing or diagnostic kit, so it gets a lower level of classification. And one of the things we've been focusing on at Keystone over the last 3 weeks has been which of our materials serves the best purpose for this nasal swab project. And frankly, the answer was pretty obvious to us pretty quickly. It was our Keysplint Soft material, which is designed for night guards, splints, repositioners in the dental space. Keystone spent 3 years to develop this very, very unique night guard material. It's been 510K cleared by the FDA. It's one of only 2 splint materials that have been cleared in the 3D printing environment for clearance in the United States. Everyone else's material has not been reviewed or cleared by the FDA. And the unique properties of Keysplint Soft actually dovetail well with the nasal swab project. So one of the real design features and unique qualities of Keysplint Soft is it is very durable, it is very strong, it'll withstand the forces of bruxism, it'll help with TMJ, but it also has the ability to be flexible and a little bit soft.
Ira, you're breaking up a little bit, Ira.
Oh, I'm sorry, let me get a little closer. The fact that Keysplint Soft has design capabilities that allow it to be flexible, allow it to be inside the body for 10, 12 hours at a clip and have passed all of its biocompatibility markers, has left this as a very good option for nasal swabs. And thus far, as Beth Israel is doing assessment, our material has tested out quite well in terms of use as a nasal swab. We are working currently with a couple partners, including our partners at Carbon, on the clear version of Keysplint Soft. And they have an optimized design that has done quite well with the Beth Israel review process. So Keystone is also looking to see where and how else we can help with other print partners who have the right setup in terms of a workflow that works with Keysplint Soft, a process and a plan for packaging the material either in a sterilized form or in an autoclaved bag to be sterilized on site at the testing centers, whether it's a hospital or a medical center, and that there's an approved kind of a commercial workflow to get the product into the market safely and in a way that it can be sterilized and used. So I've been speaking with the folks at Sprintray, with James and with Amir and members of their team, because first of all, as most of the people on this call know, Keysplint Soft, together with several other of our resins, have been fully validated in the Sprintray system, and the users of Sprintray over the last month and a half have very quickly jumped in and gained good experience with Keysplint Soft product and have really liked what they're seeing. With that experience, with the validation, with frankly the improved build plate and speed and throughput of the Sprintray Pro, and the fact that there's so many loyal users out in the marketplace who have experience working with the printing system, Sprintray could be a very potentially good place for us to be working with a nasal swab application. So I do know that there are steps and processes that have to be gone through in order to get across the goal line and have a good, safe, compatible, workable nasal swab. But we've been working very hard over the last 3 weeks to ensure that we can do that, both in terms of supply to the marketplace, supplying information to the reviewers in terms of the autoclavable nature of the material so that they can understand the physical properties of the material, so that they can best test how it flexes and how it serves as a nasal swab. So James was kind enough to invite me onto the end of this webinar today to give a little bit of a preview to the audience here about some of the work Keystone is doing on the nasal swab project and ways in which we can try and work and leverage the considerable Sprintray community to help supply the marketplace with badly needed nasal swabs. The estimates that I'm hearing, and they're a little bit all over the board, but roughly somewhere in the neighborhood of 30 to 50 million nasal swabs, if not more, could scale up to 100 million nasal swabs are needed in the United States over the next several months. It's going to take a village to do that. It's not going to just be Carbon, or it's not just going to be someone from EnvisionTech that can supply what is needed. It's going to take a village. And so we're trying to work with the appropriate partners of ours in the 3D printing sector to figure out how best to roll out this product and to make it workable for the marketplace to help our society over the next several months as we all wrestle with this pandemic. So I appreciate the time. If anybody has any questions, whether it's any of the other moderators or any of the folks in the QA section of the interface have any questions, I'll be very happy to answer them now, or if anybody wants to get in touch with us offline, we'd be very happy to answer questions as well.
Awesome. Thank you for that, Ira. I think that it's time to address the Q&A right now. There are a lot of questions that you guys have, and it's amazing. It shows, you know, it's really great that you guys are so interested in this topic, and it's so important to everyone in this industry, of course. We're actually going to take those question and answer questions, and we're going to post them online for everyone, just so that you guys don't feel ignored. We are going to figure out the best way to get you the answers. All right, Wally, Christian, do you guys have anything else before we finish up?
No, guys, thank you so much for your time.
All right, well, thank you guys. And just so that everybody knows that we, when we're done here, we're going to be sharing more information about printing all of these supplies, including swabs and PPE, as soon as the open questions around design and efficiency are confirmed. So we will be posting some more directionals about that. Thank you all for attending. This was great. And if you have any further questions, events@sprintray.com. Thank you, guys.
Thank you, everybody, for joining. Have a good day.